Today we are going to present a case of endoscopic third ventriculostomy after shunt malfunction. A 13 years old girl presented with progressive headache, vomiting, and altered level of consciousness. She had a history of ventriculoperitoneal shunt insertion 10 years back. Her Glasgow Coma scale score was 10 by 15 on admission. CT scan after BP shunt insertion showed perfectly functioning BP shunt with its position. But now, at presentation, CT scan showed dilated ventricles, especially the lateral and third ventricle, and MRI of brain showed triventriculomegaly, more marked on the right side, with stenosis of the cerebral aqueduct and overcrowding of the posterior fossa. So, on urgent basis, after having counseling with the patient family, we went for endoscopic third ventriculostomy. Endoscope was introduced into the ventricle through the right-sided Cocker's burr hole. And after entering into the ventricle, we can see the ventricular end of the ventriculoperitoneal shunt. This video is presented here as a uncut, unedited video. After identification of the foramen of Monro, we entered into the third ventricle, where we can see the basilar bifurcation through the floor of the third ventricle and dorsum sella anteriorly. Here, anterior part of the anatomy is on the top side of the video, and posterior one is the down side of the video. So we made a stoma floor of the third ventricle between the basilar bifurcation and dorsum sella. After making a hole on the floor of the third ventricle, we went for dilation of the stoma with a Fogarty catheter. One can see there is two layers on the floor. So we must penetrate the both layers. endoscope was moved down in between the basilar artery and the dorsum sella. One can see the perforator from the basilar artery. Very nice view, and one can also see the sixth nerve through the perforator. Basilar top. The floor is nicely flapping, that indicates the flow of the CSF through the stoma. We decided to make another hole on the floor to make the stoma bigger. Once again, Forhad catheter was reintroduced. The second hole, and it was enlarged and made continued with the first one. Now, second inspection through the hole to see the basilar artery and its branches. Finally, getting back and checking for any injuries to the fornix or thalamus vein or any bleeding. After operation, the patient recovered well from the anesthesia and she became fully conscious on the first postoperative day. CT scan on first postoperative day showed reduced size of ventricle and she was discharged with advice on third postoperative day.